ionizing radiation. So put the food in the microwave and leave the area, so to speak, but take some social distance
from the microwave.
Yes.
Ignorance is expensive. Yes. My entire first pregnancy, I did not eat food from the microwave. Thank you for joining us and welcome to Ask the Experts here at Parents Magazine, where you ask questions and we get an expert to answer them in the best way that they can. And today we have an obstetrician in the house, which means we'll be answering your questions regarding birth, pregnancy, and so on and so forth. So without further ado, I will let our expert introduce himself before I shoot your questions at him.
My name is Dr. Simon Moshara Kigondu. I'm a consultant obstetrician gynecologist at Exela Healthcare, KME Center, Suite 503. And in obstetrics and gynecologist, my favorite part is conducting deliveries.
You've said there's a difference between the gyna and the obstetrician. So which one do you do first? Were you a gyna first and then you became an obstetrician, or the other way around?
So an obstetrician and a gynecologist are one and the same person. It's only that when you're seeing a lady who is expectant, you're doing an obstetrics task. When you're doing the lady when she is not expectant, then you are a gynecologist. So an obstetrician and a gynecologist are the same person, except that now what defines what you call them at that particular time is if the person is expectant or not.
Oh, okay. I know I'm asking for many friends because I personally and other people have always imagined it's two different people, or imagined when I'm seeing an obstetrician. Sounds more complicated, so I'll pay more money. Okay, let me not get into that. So on to our questions, and the first question that was asked: can I blow dry my hair or get in the dryer when pregnant? I've also asked this question, but please answer for us.
So there are many precautions that generally pregnant women need to take. And a lot of things we as obstetricians and gynecologists advise is if it's not really necessary, then there is no need of doing it. But on that other side, blow dry, what are we fearing when we are doing a blow dry? There are several things. There is the hair aspect, there is the scalp aspect, and there is the baby aspect. Does a blow dry cause radiation that may affect the baby?
Does it?
The radiation caused by a blow dry is more of heat, infrared, and we have a lot of infrared radiation that is all around us. And generally, we do not say that the infrared is detrimental to the baby. A lot of studies have not been done on that because we cannot set up a study to see whether this infrared will make the baby on and off, but we have a lot of infrared. But also the blow dry itself has a bit of ionizing radiation on the where it is being generated. And some of the precautions that you may need to take when using a blow dry is, one, limit the number of times you need a blow dry because the baby will come and you'll go back to your blow dry. Or two, if you have to do it, then the distance between the blow dry and the hair can be increased. Then when you want to dry your hair, you can first use a towel so that the amount of time you use the blow dry is short, so that you do not necessarily have to start fearing is there any effect of this blow dry. And also during pregnancy, there are changes in hair that are probably better dried in the sun. And the sun has a double benefit of not only drying the hair naturally, but also vitamin D, which is useful for calcium metabolism, which is useful for development of baby bones and breast milk. So there is an advantage of natural sunlight vis-a-vis the blow dry. But the blow dry per se. It may not be a bad thing, but in pregnancy, as we say, if it can be avoided, well and
Avoid
good.
it.
And I'm sure there are some hairstyles that do not need blow dry. Are
Like
there?
this one of mine.
Yes.
Well, so we're talking about both the blow dryer and the dryer.
Yes, and the dryer. Yeah. They
And
all,
I know closely connected to that, sorry, is the microwave.
yes.
Having been there, I know we are afraid about all those things because there's a lot of information that the microwave releases things that will go into the baby. What about the microwave?
Yes, so microwave and other like electricity poles and all, they produce ionizing radiation. Of course, they have been designed to produce amounts that are not injurious to human beings, and that's why they are used often. But in the effect of pregnancy, you would want to not be too near them, as it were. And yes, so that ionizing radiation, however small it is, then in pregnancy, you want to limit exposure to it. So you only use when necessary.
So the little harm that could come, say, out of a microwave, is it from eating food that has been heated in the microwave or from being near the microwave when it is heating?
The function of the microwave is actually heating food and any other thing that you want to eat. So it is not the product of the microwave. It's actually maybe being inside the microwave, then you put it on. That's when you are exposed to the radiation. Of course, that doesn't happen.
Yeah.
But it is not the food per se. So food can actually be microwave, so to speak. But then nearness, so to speak, is what may produce ionizing radiation. So put the food in the microwave and leave the area, so to speak, but take some social distance
From the
from
microwave.
Yes.
Ignorance is expensive. My entire first pregnancy, I did not eat food from the microwave. That's what I understood. Don't eat food from the microwave. Thank you. And we'll be looking at our second question, which is something about recti, the diastasis recti.
That one.
That one. So your question number 2 is, does diastasis recti go on its own or do I need to work on it? And here I think you'll first start by saying, what is diastasis recti kwa lugha ya mama wa kawaida?
Thank you very much again for that question. Diastasis recti is a medical term, and for those who do workups, you'll know that there are these front muscles called abs. Now, abs, you have a left abs, packs. They are called six pack. Six pack. And the right abs. In between there is a connective tissue. There is a connective tissue that is actually like a tissue that joins the left and right. And it's made up of coverings of the muscles that come over and join into one. So mothers who, for instance, for any reason, if you have the stretching of the abdomen, then that middle layer will stretch. And one of the reasons why it stretches is pregnancy. When people become pregnant, then the abdomen enlarges and it stretches. So you have the abs going separate ways, so to speak. So it stretches the middle line. And that midline, after delivery, is now supposed again to shrink and come. But now, if that distance remains stretched, they say about 2.7 centimeters or more, then that is called diastasis recti. And the women will see it as a small bulge, and it looks like a ridge, and that's diastasis recti. These can be differentiated from what is called a hernia. A hernia is a similar weakness of the layers from the bottom, but now in a hernia, you get the organs that are inside coming through to that particular weakness. So defect, that would be termed hernia. So that stretching of that midline is called diastasis recti.
So diastasis recti does not cause any internal organs to bulge out.
No, so it's a weakness that because there is pressure from inside, then you see it as a bulge. It generally has no effect, so to speak, has no problem. But now a hernia needs to be distinguished from that because a hernia can cause an obstruction of the internal organs requiring surgery. So one of the ways of treating the diastasis recti is they've tried to see what the issues are, but there are some exercises specifically meant to strengthen the diastasis recti, to minimize it, so to speak. It's muscle strengthening. And the action is meant to sort of bring in the diastasis recti as opposed to what causes it as the bulging, so to speak.
And from the tone of this question, I know the problem is, having been there and met mothers, our problem is the diastasis recti causes us, even after birth, to have a big tummy.
Yes.
Don't say you've said it doesn't have a problem. There is a problem with diastasis recti
Yeah.
when you've already given birth, and then people are like, "Are you pregnant again?" Or So should I consider it a problem?
Yeah.
Is it?
So we must differentiate between diastasis recti and the decrease in tone of the abdominal muscles. So diastasis recti is specific for the midline, and therefore you have a midline bulge. The floppiness of an abdomen after delivery is as a result of the tone of the muscles being less. The tone is low, and therefore you have the abdomen falling over, and also excess fat tissue which develops during pregnancy and delivery, which can add to that turn. So it's important also to see the doctor so that you can differentiate the two, because the treatment of both is sort of different. You've heard of things like tummy tuck and things like that. You see, but for diastasis recti, you actually try to, if we are to go the surgical way, there is a way of doing abdominoplasty, meaning reducing that gap by overlapping sort of the midline grip. You see,
so the abs are kind of like overlapped together.
That particular layer. You see, the problem with it is that it's stretched like this.
Yeah.
So if you fold on itself on it into two and maybe stitch it, and then that becomes shorter and that sort of gaps it. But you see, there is the other issue where you have fat, and you've heard of some procedures where they do liposuction, like removing of the fat to reduce that fat content. And others where they do tummy tucks, where some of the layers you shed off the excess tissues and overlap, you see. So it's important also to differentiate the two between diastasis recti and these other abdominal weaknesses and increase in fat.
Okay. So for diastasis recti, you've mentioned there's surgery. Yes. There's option of surgery.
You start first with specific abdominal exercises, which would be directed to you by the physiotherapist or the gynecologists. And then if that doesn't work, then there is surgery, which is abdominoplasty. But again, if you are getting pregnant again, then sometimes maybe you would want to wait until your last child. And I think you are not yet ready for abdominoplasty.
I am so ready for it. But what I get is we need to differentiate before we go ahead and do those exercises. Maybe it's not diastasis recti. Maybe it's just less tone of the muscle, meaning they're kind of loose. Yeah, and maybe it's just fat. Yeah. Seriously. Yeah. And then finally, we will get into our third question that has something to do with tears at birth. Something somebody explained as a third-degree tear. The doctor will explain that and answer the question. Thank you. So our third question is rather interesting, Dr. It has something to do with tears. For those that don't know what a tear is, okay, the doctor will explain. But I'll read out your question first. And your question was, I had a third-degree tear. Is there a possibility of it opening during intercourse? I feel no pain though. Not my question. Your question, Doctor, begin by explaining what a tear is. Some people don't know.
Yeah. Usually the one asking the question gives the question to someone else, but we know they're asking for a neighbor. But yes, the perineum first is the anatomical site for the lady is the area where in front you have the place for passing urine, the urethra. Then you next to it you have the vaginal opening, and then behind it you have a space between the vagina and the anus where stool comes in. So if you picture that, it's very easy to picture that. So you have the anal opening, and then you have a space between the anal opening and the vagina. Then you have the vagina. Then you have the urethra where urine comes. So that whole place is termed the perineum. Yeah, that's very clear. Once you have that, then during labor and delivery, that's for me, by the way, is the favorite. That's the favorite part of my job, conducting deliveries and supporting, so to speak. We have a term called supporting the perineum. You hold it so that it does not get those tears that they are talking about, and that is one of the primary functions of the midwife and the gynecologist to conducting delivery. And the baby's head is sometimes slightly bigger than the exit, and therefore when it comes, it actually dilates. It sort of expands it a bit, yeah. And when it expands, the beauty of the vaginal orifice area is that it's expansile. It actually expands and comes back to normal after delivery. So once it expands, then sometimes the relationship between the baby's head and the vaginal orifice is that the baby's head is bigger than the vaginal orifice, or the baby comes too fast so that there is no time to relax, to hold on to that. Yeah. So it may cause a tear, some injury. So the injury can start from the inside, which is the vagina. So you have a tear there because the baby is coming like that. The injury can also be on the skin and the underlying skin. That is a tear. So the tears, that's what is a tear or a laceration. Those are the words we use. So to prevent that, we usually support, like you are holding it so that it only expands as opposed to cut. The reason you are trying to prevent the perineal tear is to prevent injuries to the other organ, like the urethra up there and the anal orifice where stool comes. So you have the vagina, which has a space between it and the anal. So if you get a tear that only affects the vagina there, that's called that's one. You get?
Is that what we call the first degree tear?
First degree, correct. That's the word. So first degree tear. If the injury extends and involves the skin and underlying tissues, that goes but does not reach the anus, that's second degree. You get? If it extends now slightly and involves the anal ring, anal ring, what is called the sphincter. The sphincter is what keeps the anal sphincter closed. External, then that is third degree. You get? If it now, not only that, extends to the anal plus a bit of the inside, called the rectum, that's fourth degree. You get? Yeah? So that is how they're called degrees. And that is what midwives and gynecologists try to prevent by supporting during delivery. If that happens, then it's then it needs repair. So what you do, first and second can actually heal on their own, and a lot of mothers who deliver at home, it heals. It may heal by primary intention or secondary intention. So the third degree will require, but we usually, repair them for faster healing. Yeah? So the others would require a repair, and you repair in the layers backwards. So you start, like, let's use a fourth degree. You start by repairing the rectum. Once you repair the rectum, you repair the anal sphincter, and you come up and repair that and the vagina. Or so that's what it is. So the reason why you repair is to prevent problems like incontinence, where a stool can actually come out on its own if
can
not
hold.
repaired, or the vaginal rim may not be able to tighten enough and can interfere with intercourse. And also the 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 so to speak, then it can also look bad, so to speak.
Okay.
You get, and they say, no, it doesn't look like it's supposed to.
Yeah.
But for your question, the one who answered, that one has no problem. Once it has been repaired within a week, it has healed. As long as you keep it clean by using saline and washing, keeping the area clean, it heals within a week. The perineum has a good blood supply, and the healing there is very fast, as long as everything is put back together.
Okay. So maybe I could ask for that person, that neighbor, and probably another neighbor.
Yes.
Yeah. How soon can they resume? How soon can one resume sexual intercourse once they have had a third degree tear?
When they are comfortable. Once the healing has occurred, then they can resume.
So, like this one who says they're feeling no pain, that means
they have no problem.
They have no problem.
If they were repaired well, and it has healed.
Okay. And the last one on these tears, does that mean that, or rather, what are the chances of delivering without a tear at all?
Yeah, a lot of people deliver without a tear, and that's why we keep improving the technique of supporting delivery, and that's why what is called skilled birth delivery is part of that. One of the advantages is trying to prevent those tears, and if they happen, you repair them quickly, they heal fast.
Oh, really? That's interesting, because out here, so many women have accepted it as part of birth. They feel like, it's just normal to give birth and tear in the process.
So with the improvements and a lot of observations, even a long time ago, what is called an episiotomy, a doctor-induced tear, where you, during delivery, you actually give it yourself. We are minimizing that until it's really, really necessary. So it's not a routine thing that should be done in pregnancy. But the person conducting the delivery can assess the need of. And a lot of times you find there is no need. So it delivers, and you keep supporting, and that will prevent the tear, or if it does, minimize the extent of the tear.
Wow. That's great. So when you say it's your favorite part, that means you really feel fulfilled when you have been able to support and there is no tear that has happened.
And the baby has cried and all that thing. We like it that way.
Oh. Yeah. Great. Thank you very much. Your questions answered, and we will be visiting more questions on another show. So keep them coming when we ask those questions on Instagram and on Facebook and everywhere on our spaces. Thank you so much, Dr. for coming. Asante sana.
You're welcome.